Hey guys, in today's video, I'm going to be giving you my best tips and product recommendations for controlling your scalp psoriasis. If you're new here, welcome. My name is Andrea. I'm a board-certified dermatologist. I would love it if you would subscribe to my YouTube channel and hit the thumbs up. It really helps my channel out a lot. What is psoriasis? Psoriasis is a chronic inflammatory disease with skin manifestations. It can show up on your scalp or anywhere else on your body, including your nails. When it comes to scalp psoriasis, it can range in severity. Very mild cases have a very fine scale, maybe diffusely throughout the scalp. More moderate cases of scalp psoriasis involve a thicker scale and sometimes more redness. In severe cases, you have very well demarcated large, thick plaques of psoriasis with an overlying thick scale. In paler skin tones, these plaques appear red with an overlying white, silvery scale. However, in deeper skin tones, these plaques appear purple, brown, or grayish. Spections. While the products and tips I'm going to be recommending in today's video can help calm down the psoriasis, and in some cases clear it temporarily, remember this is a chronic disease. These are not cures. If you have psoriasis, I strongly encourage you to see a board-certified dermatologist. There are topical medications that can control the disease, oral medications like apremilast, injections of anti-inflammatory medication into the scalp, and even eczema lasers that can help calm things down. But I do realize it's not always easy to get in to see one. The tips and products I'm recommending today can help a lot. If you start them now and stay consistent, it makes it more likely that when you do see a dermatologist, whatever treatments they recommend will have a greater chance of working. 1. Shampoo frequently. Number 1 is to shampoo your scalp as frequently as you can tolerate. We recommend this for patients with psoriasis because it helps slough off some of that built-up, scaly stuff and just kind of stay on top of it. I recognize that not all hair types tolerate daily shampooing, so go based on what your hair type tolerates, as frequently as you can. Daily is ideal, but I realize not everyone can do that. It just helps with removing that buildup, which if left unchecked becomes itchy and gets out of control. 2. Salicylic acid. Use a salicylic acid shampoo at least a few times a week, if not daily. Salicylic acid is a keratolytic. It dissolves the glue between skin cells and helps with sloughing off scale. This can really help thin out psoriasis, especially in areas with thicker plaques. Over-the-counter salicylic acid shampoos usually have 3% strength. The way to use them: ALP. Minutes while in the shower. Then rinse. This allows the ingredient to really work. Dermatologists can prescribe higher strengths, but OTC products are a great place to start. If you start now and stay consistent, prescription treatments will work better and faster. 3. Coal tar. Another product to incorporate into your routine is coal tar shampoo, like Neutrogena T-Gel. Coal tar sounds scary, but it's actually SMB anti-inflammatory. Pounded anti-proliferative psoriasis is a hyperproliferative skin disorder, and coal tar helps put the brakes on. Warning: it smells unpleasant. Can shower or tub to use. Lather into scalp. Leave for 10 minutes. Rinse. You don't need to use it daily. Once a week can help calm inflammation, thin out plaques, and reduce itch. 4. Anti-dandruff shampoo. Anti-dandruff shampoos with zinc pyrithione or selenium sulfide can help too. They are anti-inflammatory, reduce the burden of malassezia, a yeast on everyone's skin. In people with psoriasis or dandruff, the immune system can overreact to malassezia. These shampoos help reduce the yeast and therefore inflammation. 5. Mineral oil. If your hair type can't tolerate frequent shampooing, consider mineral oil to stay on top of buildup. Mineral oil is very safe. Doesn't go rancid, unlike many natural oils. Can be found in the laxatives section at pharmacies. It's good for dry or oily hair and even for those who have trouble combing their hair. Certain massage into scalp, especially scaly areas. Put on a shower cap. A-sized, wait 20 minutes. Rinse in the shower. Alternative, coconut oil. Helps soften and lift scale. Has anti-inflammatory properties. Help with hair frizz and hydro-fatigue. Caution. Coconut oil may cause breakouts in acne-prone individuals, but if you're rinsing it out, it shouldn't be a problem. 6. Don't pick. Do not pick or scratch at psoriasis. It's tempting, but it worsens things due to the Koebner phenomenon, where trauma to the skin triggers more psoriasis. Avoid picking, scratching, scalp massaging brushes, dry brushing. Be gentle when applying products. Use soft circular motions with your finger pads. 7. Gentle hairstyling. Use very gentle hairstyle. Avoid hot tools, blow dryers, curling irons, flat irons, perms or relaxers, tighter braids. These can cause inflammation, traction alopecia, more psoriasis lesions. Use the cool setting on your dryer. Keep styles loose. Consider bangs to camouflage hairline psoriasis. 8. Lifestyle psoriasis is a systemic inflammatory disease, not just a skin condition. People with psoriasis are more likely to be overweight or obese, have cardiovascular disease, have diabetes. Even small lifestyle changes can help. Walk more. Cut back on sugary drinks. Improve sleep. Eat anti-inflammatory foods, fruits, veggies. Sleep is crucial. Poor sleep increases inflammation. If you already have psoriasis, 1 or 2 nights of poor sleep can show up on your skin. Good sleep helps reduce inflammation and even improves weight control. Stress management is another key. Everyone handles stress differently. Try hobbies, crafts, or exercise. Make time daily for self-care. No need for a yoga retreat every day, just something small, consistently. Mental health matters too. People with psoriasis are at higher risk for depression, excess abuse. If you're struggling, seek professional help. Don't rely solely on forums or self-help content. Talk to your primary care doctor. Even moderate alcohol use increases inflammation. Cutting back, just a little, can make a big difference. Yeah, this video went from anti-dandruff shampoos to alcohol and mental health. But that's what we do here. We cover everything. With any skin condition, lifestyle plays the biggest role. Psoriasis can be frustrating, but you can make changes, small ones that lead to big improvements. You don't have to wait for a dermatologist to get started. Do what you can now. Take control where you can, and you'll start to feel more calm, more in control, and your skin will show it. If this video helped, give it a thumbs up and share it with your friends. I have more psoriasis content, some older videos that are still relevant, so check those out. Let me know in the comments what other topics you'd like to see. I'd be happy to create more videos for you. And as always, don't forget sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.